As mothers raising young children or women who are primary caregivers to young children, the responsibility of looking after a child can sometimes be overwhelming. It gets especially tough when children fall ill, raising alarming concerns for us as women who often happen to be the primary caregivers. No woman wants their child or ward to be negatively impacted due to a health scare or challenging health-related condition. In this episode, we shall discuss the journey of empowering women in more depth so they can be best prepared to care for their young ones. Welcome to the Help We Need podcast, where we explore topics that empower women and support their well-being. I'm your host, Funmi-Kẹ́ Moronkeji, and today we will discuss a topic close to the hearts of many mothers or carers of young children, that is, navigating motherhood through child development stages to handling common illnesses. We will be answering some common questions and concerns that you may have regarding caring for your newborns, monitoring your child's developmental milestones, and managing common illnesses and health issues in children. We will also address common myths and fears and provide practical advice from delivery to nurturing your little ones through typical health conditions. So let's get started. Today, our special guest speaker is Dr. Eunice Ade Atiemo. Dr. Eunice is a specialist pediatrician, lecturer, clinical researcher, and child health advocate known for her passion, dedication, and expertise. She has over 17 years of experience managing infants and children of all ages. Her expertise cuts across a wide range of clinical proficiency, such as emergency, neonatal care, outpatient, and inpatient pediatric management. Welcome, Dr. Eunice, and thank you so much for joining us today to talk about how we can keep our kids healthy as young mothers or caregivers of young children.
Thank you so much, Funmi-Kẹ́. I'm really pleased to be here, and thank you so much for having me on the episode.
Absolutely, and we look forward to hearing about all you will share on this podcast today. So, first of all, I would like our audience to get to know you better. So can you share your background, what led you to become a pediatrician, and why are you so dedicated to young children?
So I was one of those children, you know, when sometimes you ask a 3-year-old, what do you want to do when you grow up? And they say, I want to be a doctor. That was me. I mean, ever since I can remember, I wanted to be a doctor. And I never changed my mind. Never. My parents tried to get me to, you know, have a plan B or a plan C, you know, just in case it doesn't work out. And I told them that my plan A is to be a doctor, my plan B is to be a doctor, and my plan C. So honestly, I never changed my mind. And it just grew stronger and stronger. And I went to medical school that was in Cape Town, South Africa. I had a wonderful time. While I was in Cape Town, I thought I was going to do surgery because I was interested in surgery. But it was when I moved back to Ghana and I was doing my house job. So I started in pediatrics. And when I started pediatrics, I just fell in love with the kids, with the practice. Children are so resilient. They're so interesting. You know, the young ones haven't learned to lie yet, which is nice. So it's just, I've always, from the first day I started practicing in pediatrics, I wanted to do pediatrics. And yeah, 20 years later, we're still enjoying it. Yeah.
Wow, that's a lovely story. Your plan A, plan B, and plan C was actually to be a doctor. And congratulations, I think you pulled it through. So thank you for sharing your story with us. So let me kick off by First of all, just saying that obviously every mother on the call, I'm assuming, knows that the journey of motherhood begins before the baby arrives, right? That is from the moment of conception to managing their health and well-being, like eating a balanced diet, staying active, taking proper nutritional supplements, attending regular prenatal checkups, because obviously it plays a crucial role in the child's development in the womb.
Absolutely.
Well, that's mostly what we were told, right? So, but yes, it does. So my question for you really is, when does the childcare journey truly begin? Is it before or is it after conception?
So thanks, Fumike, for the question. It's actually an important question because, as you mentioned, having a good prenatal journey helps us provide as ideal or the best environment for growth and the ability to kind of catch up with potential issues early on, right? So ideally, you want to be able to provide the best environment for a child, which even starts before conception. But it's important to note that the journey to motherhood is so diverse. I mean, I have some patients who the mother found out she was pregnant 3 weeks before the baby was born, right? She had literally no prenatal care. It just happened as a surprise and she didn't realize. You've got mothers who become mothers through adoption, through becoming a stepmother. You've got people who end up becoming the primary caregivers of maybe their nieces or nephews under, very quick circumstances. So the journey to motherhood might not always be one that you have much time to prepare, right? So it's a different story for everyone. And as much as possible, we do try, if you are pregnant, to try to provide good prenatal care and support before the baby is born, but that is not possible for everyone. And so we need to be aware that the journey to motherhood is very diverse. But whichever way you become a mother, you know that once you have a child, they become your number one priority from day one. And so as pediatricians, we try to support mothers and children so that the children can really just reach their full potential, essentially. So, yeah.
Well, that's really good to know, and I like how you've classified the variables, right? Because most times we often look at bringing children into the world from just the traditional perspective, right? And I guess some of us listening on the call could have that responsibility of taking care of children. We may not necessarily be the biological mom. So I like how you've kind of expanded the scope so that whichever way it comes to you, you are included. And obviously, the topic for today resonates very much with you. And I think it's also a good opportunity for women listening on the call just to know. So just in case, at least you're aware and knowledgeable and all that. So thank you for, for reassuring us of our responsibilities and, the role that we play in terms of how we support our children and invariably help them grow up as healthy youngsters. So as we progress, I would like to touch on some common myths and fears that young mothers or mothers raising young children have that surround, bringing up children. And I would really appreciate to help us address them. So the first myth is, I've looked after myself during pregnancy, read all the books, attended prenatal childcare classes, and I've prepared well. Therefore, once my child is born, everything should be fine.
Wouldn't that be wonderful? I mean, in this day and age, people do try to be well prepared. You read all the books, you go on Instagram, you do all the Pilates and the mother's classes and the prenatal classes, and you see your breastfeeding consultant before before the baby comes, and you feel like you've done everything that can prepare you for being a mother. And then the baby comes, and it's almost as if everything just falls out the window, right? Because you're just so overwhelmed. You didn't realize how much sleep deprivation can affect your mental health and just the way you think about things. And so it's absolutely fantastic to prepare, but you really have to be aware that the journey is going to be unique. It's going to have its own challenges. You cannot prepare for everything. And it's a journey that you have to take. And the fact is that everybody's journey is unique and is very different, right? You can have two mothers who deliver babies on the same day, both boys, both the same weight. They look almost like twins, but the experience is going to be so different. One baby may not be feeding well. One baby may be formula fed. One baby may be developing at a different rate. One baby may decide to sleep through the night at 2 months old, and the other is still, waking up every 2 hours to feed. So there are so many variables. And so you really have to be open to the fact that anything can happen, and that you have the support from family, from your partner, from friends, from your doctor, from your pediatrician, who are able to really support you through the journey, during the journey, which is the most important thing. So it's very good to prepare, but you should also be prepared for the unexpected, I think, when it comes to
Yeah,
children and
absolutely. And
babies.
I like the way you talked about the experiences, right? And you've also contrasted or compared it with two mothers who may have happened to give birth on the same day, and yet the experiences are different. And I think sometimes, I think the uneasiness comes from social media, right? And people kind of tune into that. But it's helpful, as you've made it or laid it bare, to say, it's good to prepare, but expect that your experience may be different from one person to the other. So hopefully, our ladies listening on the call have taken that as a very important note, so that they also give themselves a level of peace and, well-being, to be able to
Yeah,
expect that the experience may be
will be
different to
different.
the other person. So thank you for elaborating on that. So I'm going into the next myth, which is myth 2. This is an interesting one. I'm not sure how this came up, but there is a myth that breastfeeding is always easy. Every mother should breastfeed. So how do you respond to that?
That is a very, very good question. And it's literally something that I probably deal with almost every day in my practice. Um, of course, you've got the saying, breast is best. And breast milk is a fantastic and a perfect nutrition for babies, right? But the journey in breastfeeding is not always easy. Some mothers cannot breastfeed, do not want to breastfeed, are unable to breastfeed for various reasons. So we need to be aware that even as we absolutely want to promote breastfeeding, there are quite a few challenges that can come with breastfeeding, and it might not always be a choice for mothers or for babies. Common problems that we see, especially at the beginning, and especially for first-time mothers, because the first time that the body has to, sustain life for somebody else can be very challenging, right? It tends to get easier if you have a second or a third child, but it takes several weeks sometimes for the amount of breast milk to even increase. And so it can be a very frustrating time for mom and also for the baby who's like, I'm hungry. Why is there not enough for me? So just getting over that initial hurdle, even latching can be a very problematic time for some mothers. The baby is not latching, the baby is biting the nipple, the baby is struggling with feeding from the breast. And then you give them the bottle and they're like, oh, this is nice. I'm going to take this instead. So some mothers find breastfeeding very painful. And usually there's a reason for that. And it has to do with the technique and the latch. So they often need to be supported through that. Sometimes you can even develop infection, so mastitis, inflamed nipples, painful nipples, which means that you may not even be able to breastfeed for a short period of time, depending on how severe it is. Some mothers do everything that they can. They drink all the potions and the fenugreek and everything, and still they're not able to provide enough breast milk to satisfy the needs of their baby. And another mother might have so much breast milk, she doesn't know what to do with it. I mean, she literally has a freezer full of breast milk, and she's like, how do I slow it down? Right? So everybody's journey is different. And we also have support for mothers. We've got your pediatrician, your doctor, lactation consultants, nurses, family members, your grandmother, your mother. So we do have support structures available. And so when mothers are struggling, it's important that they're willing to ask for help and seek the help that they need instead of being frustrated, because it can be very frustrating when you feel like you're not able to breastfeed as you wish you could have or you would have liked to. Yeah.
Absolutely. And I think it's very helpful that you've just also shed light and put perspective. And I think the key thing here is that mothers should have an open mind, or expectant mothers should have an open mind. And again, for some of us mothers who are on the call who've adopted children, obviously that's not much of a hurdle because,
Yes.
you obviously be bottle feeding. But for mothers that, are new into the role, there shouldn't be any regret or shame.
Or guilt.
We need to listen to our bodies. We need to adapt to the circumstances. So thank you so much for really shedding light on that. And just, I guess for some, it's a sigh of relief just to hear from you that the experience again may be different, and just go with the flow. And as long as your child is well fed and getting the right nutrition, then that's what really matters. So thank you for that
Absolutely.
perspective that you just shared. So I'm moving on to myth 3. This is an interesting one. And it says that babies must feed every 3 hours, including at night. So how do you respond to this? Is it true?
So this is a good question. And this is something I also face almost every day because, the parents come in and they've been told something at the hospital, often this exact thing, that you should feed your baby every 3 hours, the baby shouldn't go hungry. And so some mothers are putting their baby on a schedule, and the baby has fed, and 2 hours later the baby's showing signs of hunger. You're not going to really wait another hour if your baby is screaming for food, right? So, I mean, really, what we need to understand is that every baby is different. Babies' needs are different. So you could even have two babies who weigh exactly the same, but they require different amounts of milk. You also have babies who are preterm. Some babies are born very early. Some babies are born later. And so their needs differ. Boys and girls, they grow and they feed at different rates. We've got growth spurts. So children will usually lose up to about 10% of their weight in the first few days of life. And they will take time to regain that birth weight. Could be in 10 days, could be in 2 weeks. Sometimes for breastfed babies, we give them up to 3 weeks. So there's a very wide range of what is normal, right? And what we really need to understand about babies is that they are very, very intuitive. They know exactly how much their body needs. They do not overfeed, which is fantastic. They will stop when they're full, and they will want food when they're hungry. And so they know exactly how much they need. And so we really need to listen to their cues. What we recommend is that you need to feed the baby on demand. That means when they want and as much as they want, right? So the 3-hour thing actually came because we looked at thousands and thousands of babies, and we realized that on average, in the first month or two, babies may be feeding an average of about 7 to 9 times in a 24-hour period. So we looked at and we said, okay, the average is about 8. So if I, for example, have 40 babies in my neonatal unit, I can't just be feeding them willy-nilly whenever they want, because then I won't get any work done. So we were like, okay, it's 24 hours. We know babies feed an average of about 8 times. We're going to do 24 and we're going to divide by 8. We're going to get 3. So that's where that 3-hour thing came from. But it's not necessarily the way a baby would naturally want to feed, right? At the beginning, babies may be cluster feeding because they have a lot of catch-up growth to do. So they might even be feeding every hour, every 1.5 hours, every 2 hours. And then they might decide, yeah, I want to sleep for 4 hours. And when I'm hungry, I will wake up. So generally, a very well baby is not going to sleep through hunger. If they are hungry, they will wake up and they will definitely start to show the signs and the cues of hunger. And it takes some time to figure them out, but most times you can figure it out, within a short period of time. They start rooting, they start looking around, they start sticking out their tongue, they start chewing on their hands. And that's usually their sign that, okay, I'm getting hungry, please feed me. And then if they're not fed, they start to cry and then they start to scream. So by the time they're screaming, I mean, we may be a little bit late, right? So the 3 hours is supposed to be a bit of a guide, but it's really not necessarily the way a baby is going to want to feed. And generally, we find that if we allow the child to feed on demand as much as they want, they will sort themselves out. They will grow according to the way they are supposed to grow. They will catch up. And when they catch up, they can even reduce the amount of milk that they're taking. I mean, they are fantastic. It's one of the reasons I love babies. They're very different from adults. We go to the restaurant, we eat, we're full. We won't stop because dessert is coming. We're just going to power through. Babies, they do not do that. And that's one thing I absolutely love about babies.
Okay, so they power through only when necessary. So what I'm
Yes.
hearing from you, and I think we really need to zoom in and focus on for some of us listening in on the call, is every baby is different. I think we can't overemphasize. You said that over and over again. So mothers on the call, please learn to listen to your baby, focus on their cues. Don't have a rigid schedule, because sometimes those schedules are just guidelines. If I'm listening to you, that's what you're saying. They're just guidelines. Observe your baby, listen to your baby. When they're hungry, they will let you know. And just go with the flow. Again, go with the flow. And I think it's important to just have an open mind again, because you're able to read your baby better. You're able to respond to your baby better. And in doing so, you build a stronger bond, right, between yourself and your baby. Because most times when we are really very fixated on something that we expect to be done, then that moment, where we need to really bond with the baby is lost on us, because we're
Yes.
unnecessarily worried, about
Yes.
they're not feeding every 3 hours or they're overdoing it.
Yes.
And then we really panic. So I think, and this is where I probably would need you to kind of, I stand corrected, but I know there are always exceptions to the rule. And maybe
Absolutely.
some babies don't feed as much as they should. What would you say to mothers who fall in this category? So they want to feed the baby. They're told to listen to the baby and follow the baby's cues, but obviously it appears the baby is not really feeding well, and it may be telling in terms of the development and how the baby is showing up. So what would you say to such mothers in this category?
So you're absolutely right. And why we tend to have quite a few doctor's visits early on, right? Because the best marker of whether a baby is eating enough is whether they are growing appropriately, right? Are they gaining weight as we would expect for them? Is their length increasing? Is their head circumference increasing? So sometimes the mothers might think, I don't think my baby is getting enough food. But when we check their weight gain, we see that the baby is actually thriving and the baby is getting and is growing very well. And you can also have some times where we're checking the child's weight and we usually chart them. So we look at them on their chart. we've got a very wide range of normal, right? Because some babies are born normal, well-term babies. Their weight can vary anywhere from 2.5 even up to 4 kilos or more, right? So a baby who is maybe 4.5 kilos at birth obviously needs to eat more or need more milk just to maintain their growth on that high trajectory than a baby who is maybe 2.5 kilos or 2.7 kilos. So that's the first thing to understand, is that we need to decide, we can only decide on whether a baby is getting enough food based on how their weight is going, right? So you've got some children who maybe they're breastfeeding and mother's milk hasn't really come in. So the baby is sucking and feeding every hour, every 2 hours, but the baby's weight is not going up. So sometimes it has to do with their latch. And so we need to be able as doctors to find out what might be the problem. Some babies actually may have a heart condition, so they're actually not able to take large amounts of food at a time. They get tired when they eat, right? So there are a wide variety of things that may affect a baby's ability to feed enough and to grow. And this is where your regular pediatrician visits helps, because we monitor their growth and we're able to pick up very early whether they're gaining as we would expect or not. And then we can look into what might be the problem and help solve the problem, essentially.
Thank you. To me, I think that's a lifeline. It's amazing how you've just really broadened that hope. And I know we have a number of women listening on the call from different parts of the world. So it's really important that we are doing the checkups, right? And as much as we can, making sure that we are not, failing to meet the appointments. So just to double check to make sure that the baby is doing well. So thank you for just keying into that and bringing that up further, close and personal, so that our mothers can really pay attention to that. So I'm going on to meet 4. And meet 4 is, about caring for your newborn all by yourself. Shows that you're a loving mother, right? And if you allow people to care for the child for you, you're not paying attention, you're not considerate, you're just relegating your care to someone else. So that's an interesting one. I don't know how women are surviving with that mindset, but if you could just help us unravel this a bit more, how would you respond to this myth?
So this is it's a myth that absolutely needs to be shattered. Caring, we are designed as human beings to live in community, right? We're not designed to do everything on our own. And I think that's the most important thing to really take away from this, because mothers feel a lot of responsibility, often a lot of guilt about not being the one and only in their child's life. But really, we actually find that in situations where it's only just the mother and the baby and it's just them, the baby is not able to thrive, because we learn so many things by being social, by interacting with different people. So that's on one side. And the other thing is that really trying to do it all on your own is almost impossible. I mean, it is a tremendous amount of work to look after a newborn. It is tremendous. And when mothers want to try to do everything on their own, or are afraid or not willing to ask for help or assistance, what happens is that you get burnt out, you get frustrated, you are sleep deprived, you make wrong decisions because you think you're doing something, but you're actually so tired that you mix the wrong milk, or there's so many mistakes that can happen when you're tired. And mothers are almost, you kind of live on this I'm always tired kind of, journey. You never get enough rest. But the fact is that we need to be able and willing to ask for help. Sometimes, the fathers are there and they're like, listen, let me take the baby, let me do this and let me do that. And the mothers are like, no, you can't do it right. And, I'm the one who can do it. And I'm the only one who can do it right. We see it all the time. And then the mothers start complaining how tired they are and how burnt out they are. And the problem is that if the mother's health is not looked after, a healthy mother is able to better look after a baby for a baby's health to be maintained. So if you're stressed out, if you're mentally fatigued, if you're physically fatigued, if you're frustrated, if you are feeling overwhelmed, this is going to affect your breast milk. It's going to affect the way you're able to care for your child. It's going to affect your child's growth and development, right? So it's very important that ask for help as is available, because some people do have more supports than others. And but really it is something that is very dear to my heart, because I see a lot of mothers who are really struggling because they want to do everything themselves, because they think that that is what society expects for them. This is their own expectation for themselves, which is really not realistic, you know, and it doesn't help anyone.
Yeah, thank you for sharing that. And I think it probably comes with culture and
Yes.
what's been passed over from generation to generation. And sometimes I think we need to step back and as women and
Mm-hmm.
listen to ourselves as well. I mean, I like the fact where you're saying, you know, the fathers are there. If they want to help, let them help. They are also a part of that journey. We didn't suddenly have the babies by ourselves, so to speak.
Exactly.
So it's good to let the fathers join in the care. And maybe for some of us who are living in diaspora and not really connected to family and relations, there should be some form of community
Yeah.
where we can lean on a friend's mom or
Yeah.
people just come visiting. Because I mean, having a baby is good news. Everybody wants to rejoice with you, and if people are willing to offer help and support,
Yeah.
let them. And I
Absolutely.
think a key thing also is just I like the fact that you said, you know, we need to balance it out really, because that's what would make the mother healthy to be able to take care of a healthy baby, and just every other person is impacted as well. And I think oftentimes some mothers, if they are too fixated on them doing it all by themselves, obviously it leads to exhaustion, like you've pointed out, and painfully resentment, you know?
Absolutely.
And those emotions could, you know, be on a scale of extreme to medium to whatever. So it's, I think the ripple effects may be damaging. So women
Mhm.
listening in on the call, it's okay, please, it's okay to ask for help. And it's okay to listen to your body as well. And when you know something is wrong, please speak up. So thank you so much
Absolutely.
for calling that out. I'm moving to mid-5 now. And it says that if your child isn't meeting their milestones, I mean, what do I mean by milestones? Like crawling, they're babbling and talking when you expect they should, then there is a huge cause for alarm. You should be worried. Now, I'm kind of leaning into this one, but I just want to hear from you. What are your thoughts?
So we do the people panic a lot. And a lot of the time, our fears or our anxieties may not actually be rooted in reality, right? So in the same way as I mentioned that babies have huge variation in their size, in, you know, the way in which they grow, it's the same with developmental milestones, as we put it. So at certain points, we expect babies to be able to do certain things, but there's also a very wide range of what we consider to be normal, right? So let's say from their motor development, you know, when babies are born, their heads are very, you know, weak and flopping all over the place. By the time they're a month old, their head's a little sturdy. By the time they're 2 months old, they're looking up, they're looking around, they're very alert. By the time most babies are about 3 to 4 months, they're able to sit with support. Then eventually they move to sitting without support. And then they move to some will crawl. Crawling is an interesting one. We might talk about that later. But, you know, then they'll stand and then they'll walk and then they'll run. So you've got a progression, right? So as
Mm.
pediatricians, what is most important for us, is that a child is progressing from one developmental milestone to the other. They may do it at different
Okay.
rates, but the most important thing is progression and not regression, which means that a child used to be able to sit by themselves and now they're not able to sit, right? So if they're losing abilities that they had previously been able to do, that's something that we definitely need to investigate further. But there's a very wide range of normal. So for example, some children will never crawl. They go from sitting to standing. They're like, I'm not interested in crawling. In fact, we've actually taken crawling out of our developmental milestone list because we've always known that a certain number of children may not be interested in crawling. They just want to stand. And once they stand, they're like, I'm not going back, right? I'm moving forward. And also crawling is something that a lot of parents are concerned about, but crawling means any movement that is not walking from one end of a place to another. So some babies will roll, they will bottom shuffle, they will commando crawl, they will, as if they're swimming. It all counts as crawling. So sometimes even our definition of what we consider to be a milestone might be the issue. And we also have to remember the range of normal. Some children walk very early. At 10 months, they're walking. And some children will walk at 14 months or 15 months, and they're still perfectly normal, right? So
Mm.
what is important is that the child is progressing. And this is another reason why we recommend that you see your pediatrician regularly, or your doctor or your midwife or whoever looks after the child in your society, because usually with the vaccines that we give or regular checkups, we check for these developmental milestones. So we ask certain questions, which might seem silly, but we're asking them for specific reasons because we want to check to make sure that things are moving as we would expect. And if we feel that there is a delay or there is a regression, then we look at it even more closely and see what we can do. Because oftentimes, if you're able to pick it up early, we're actually able to do something about it. So it really goes back to not being alarmed. If you have a cause for concern, come and see your doctor, see your pediatrician, see your doctor, see your GP, whoever looks after your child, discuss it. Don't go to social media. And then we will be able to, most of the time, it's just about reassurance that, oh, your baby is actually doing fine. Or if we think that there's a cause for concern, then we can look at it and put measures in place to help the child meet their full potential.
Well, thank you. That's really helpful. I like the way you've classified, you said there's a range of normal.
Yeah.
And just hearing you say that some children don't crawl. So I guess that's resonating with our listeners. So there's a range of normal, and you need to check with your doctor if you are in any way from concerned, and let them be able to look into it and help you through the process. There's one more myth that I have, which is the last, I think, myth number 6 now, and it's about, this is quite familiar, and it's about teething. So I know this is also something that women sometimes are hovering around, right? Like, how do I manage this level of milestone? And most times, I think it's more related to if the child has fever, then maybe they're teething. So could you just help us understand this a bit more? Is teething what causes fever? Is there a connection, or we need to separate the two?
So let me start with a simple answer about the fever. The truth is that teething does not cause fever. It actually doesn't cause fever. It doesn't cause diarrhea, doesn't cause diaper rash, doesn't cause a runny nose. These are common things that we see on a daily basis. I'll explain that in a second, but there's something teething, just like the developmental milestones, there's a very wide range of normal, right? So when a lot of parents around 4 months, especially if it's your first baby, at 4 months developmentally, children find their mouths, their hands find their mouths. So around 4 months, 3 to 4 months, babies are drooling all the time. Their hands are always in their mouth. The parents are very convinced that the child is teething, but most of the time they're actually not teething. It's actually a developmental milestone. So most of the time, the first teeth are the two bottom teeth. And on average, maybe about 40 to 50% of babies, they might get their first tooth around about 6 to 7 months. Some may get it early, maybe around 5 months. Some children won't get their first tooth till they're 11 or 12 months. In fact, I have one patient who got her first tooth. She was almost 2 years old. I think she was about 20 months old. And she was
Wow.
perfectly fine. She was eating chicken bones. She was, I mean, doing everything. She had no teeth, but she was fine, right? So that's one thing about teething, that there's a very wide range of normal. Now about fever, you can imagine that if teething caused fever, we would have millions and millions of infants with fever all the time, right? It's actually, it's not really the case. If your child actually has a fever, which means a significantly elevated temperature, there's another reason for it. They might be teething, but it's not the teething that's causing the fever. And it's important to note this because a lot of the times people might blame teething for a fever, which is being caused by something else, which means that it's going to cause a delay in seeking care for certain infections that might be causing the fever, right? So there's certain things like ear infections, maybe urinary tract infections. The babies will have a fever, but not much else. They're just irritable, they have a fever, and the parents will think, oh, it's just teething, so let's just wait it out. But if your child's temperature is 38, 38.5, and it's a baby, it's not from teething, right? Teething can cause discomfort. It can cause, their gums get a bit irritated. They'll be chewing, they'll be biting. There might be a bit of discomfort, and that's true, but it's not actually going to cause a fever. And of course, you need to remember that normal temperature is between about 36.5 and 37.5, right? So your child's temperature might seem a bit elevated, but it's actually still within the normal range, and it's not actually a fever, right? So the irritability with the teething might cause your normal temperature to rise a little bit, but it's not going to cause a fever. So it really is a myth that teething causes a fever. It actually doesn't. So if your child has a fever, we need to figure out what is the cause of the fever. Most of the time it's just viral or something, not worrying, but it's not from teething. Yeah.
Well, thank you so much. I wish somebody told me this at earlier part of life, but thank goodness at least we have the information that it's open to us now, and I'm sure that our mothers and women listening in really appreciate you just helping us expand this a little bit more, right? There's a range of normal. I keep hearing you say that over and over and over again. So thank you for just helping us demystify this myths and just providing perspective. And just helping us, allay those fears, right? Those fears really need not be there. And instead of listening to social media, maybe we need to listen more to our doctors, pay attention to our babies. And if we do notice anything as mothers, obviously, where we have a bond with the baby, then we need to seek the right type of guidance. So I believe your insights have been very educative and very helpful for our listening audience as well. Okay, so I'm just going to move on, Dr. Eunice. I would want us to discuss typical health conditions. I know we've just talked about fevers, but I want us to still zoom in on this a bit more. So health conditions that cause fevers in children, could you help us really unravel this a bit more? Like, what should our mothers be paying attention to, when their children are not feeling well? And if I need to just open this up a bit further, like what common illnesses do children develop and how could they be effectively managed? Obviously, that leads to the fever, and which ones can mothers take care of at home, and which ones should they be running to the hospital to see a doctor for?
So this is a very, very important question, and a very important discussion. And it's something that it's basically our bread and butter as pediatricians and as doctors. What we need to understand is that, so when it comes to fever, fever is the body's way of dealing with illness. So illness could be a viral infection, it could be a bacterial infection, it could be something inflammatory. And so there actually is a benefit to fever, at least to some extent. And it's also a cue which tells us that, something is going on in the body. It's part of the body's immune response to viruses, parasites, and other bugs. So that's the first thing. The second thing to note is that at the moment we're currently in Dubai, and there's so many illnesses going around. I mean, half the children in schools are sick at the moment with all sorts of things. And we tend to see a lot of viruses and viral illnesses and other illnesses in the first few years of life, right? Because there are literally hundreds and hundreds of viruses that as human beings we need to be exposed to and produce what we call antibodies, which help protect us against future infections of the same virus, right? So a lot of people talk about, oh, my child has a cold. The common cold virus, so the virus that causes what we call the common cold, it's called rhinovirus or enteroviruses. There are over 100 different types of rhinoviruses, right? You've got adenoviruses, there are a whole bunch of them. The coronaviruses that we all know and love, there are now about 7. There used to be 4, and in the last 2 decades, another 3 have joined the party. So now we have 7. Para-influenza viruses, RSV, there's so many viruses that we are exposed to as human beings, right? And on average, the statistics say that maybe a child between the age of 1 and 2 years old, they might get an average of about 10 to 12 viral illnesses a year. This is worldwide, but in Dubai, I think the figure is actually a little bit higher because we have a very international population. People travel out and then they all come back in September with all their viruses after their summer holidays. So children get sick a lot. They have coughs, colds, runny noses, and that sort of thing. And I often get the question that the parents are like, oh, there must be something wrong with my child's immune system because they're getting so many illnesses. I mean, there must be something wrong with them. But there's actually nothing wrong with their immune system. It's simply the number of new viruses that they are encountering that the body needs to deal with and develop antibody protection against. Now, if it's your first time at nursery, you know how nursery children are. They like kissing each other, licking each other's toes and noses, and sticking fingers in other people's noses. I mean, it's literally the perfect storm, and they will get one virus after another after another. So we need to understand that the most common cause of fever in children are actually viral infections. And viral infections are not treated with antibiotics, which is something we also need to know, right? So the majority of illnesses, especially in young children, with common symptoms like fever, runny nose, cough, tiredness, bit of diarrhea, their appetite is down, the majority of these are actually caused by viruses, which means that we treat them symptomatically. We are just trying to help the child to be comfortable enough while the body takes care of the virus, right? Which is why we try to manage their temperature, because if your temperature is 39 degrees, you're going to feel awful. So we give fever medication to try and bring the temperature down, to try and make the child be more comfortable. We try to keep their noses clear so that they can breathe better. We try to keep them hydrated because they're not eating very well. So it's really, for most of the illnesses children have in the first 4 to 5 years of life, the majority of them are viral. So after you've had the first or second or third virus and you've been to the doctor, you start to figure out that, oh, this is just something viral and I can manage it at home, right? And of course, this is not always the case. So sometimes there's something else that's more severe that's going on, right? So we can talk about fevers. Now, fever is very common. So the fact that your child has a high fever doesn't mean that it's bacterial or viral, because oftentimes the viruses can even cause much higher temperatures than a bacterial infection, which is more severe and needs antibiotics or other treatment, right? So what is important is, how does the temperature respond to appropriate fever medication, right? That's really, it's a good marker of trying to figure out what might be the cause of a fever in a child, right? So as we mentioned, a temperature above 37.5 is considered an elevated temperature, right? Usually people will say, we'll only call it fever if it's about 38 degrees Celsius or higher, but anything above 37.5 is an elevated temperature. And some children might come to the clinic with a temperature of 40 degrees, right? And they will be feeling very uncomfortable, okay? But the fact that they have a temperature of 40 degrees doesn't mean that they're any more sick than a child who has a temperature of 38, right? Because how high your temperature goes has to do with your body's own unique way of dealing with viruses. So you could have two children with exactly the same virus, and one child's temperature goes up to 40 degrees, and one child's temperature will only go up to 38.5, but they have exactly the same virus, right? So for us, it's important after you see your doctor we usually give fever medication, either paracetamol, brufen, ibuprofen, which helps to bring the fever down, but it's only temporary. Because, for example, paracetamol will last for about 4 hours, which means that after 4 hours, once the medication wears off, we expect the temperature to come back. Ibuprofen or brufen can usually bring your temperature down and keep it down for about 6 hours. After 6 hours, we expect the temperature to come back, because we're not taking away the body's response. If we didn't give them any medication, the fever would just be there, right? So most of the viral illnesses, the fever tends to respond as we would expect to the fever medication, right? So maybe you gave paracetamol at 8 o'clock. We expect that by 12 o'clock, the temperature will start going up. The child is feeling uncomfortable, you may give another dose, right? And usually we only need to give fever medication if the child is uncomfortable, right? Because you could have a child with a temperature of 38 degrees and they're running around and they're eating and they're playing and they're dancing and they're doing all sorts of things. I mean, that child really doesn't need any paracetamol, right? You could have another child whose temperature is 38.2 and they are feeling so miserable and they're like, oh, I feel sick and I feel terrible. And then you give them paracetamol, in an hour, their temperature comes down and then they're up and they're running around again, right? So treating a fever has to do with how uncomfortable it is for the child and how high the temperature is, and what are the other symptoms that are associated with it, right? So with viral infections, the way that we know things are getting better, and this is important, is that after the first day or two, you know that things are getting better when the time in between the temperatures starts to get longer, right? So let's say you gave paracetamol and you had to be giving paracetamol every 4 or 5 hours because the temperature just kept coming back. By the next day, you gave paracetamol at 8 o'clock, and by 2 o'clock, 3 o'clock, the child is still fine, and the temperature only came back at 3:30, right? So it means that you had a good number of hours where the paracetamol had worn off, but the child's temperature was still fine. So if you're managing at home, the child has runny nose, viral symptoms, and you see that the time between the temperatures is getting longer and how high the temperature is starting to come down, then you know that the body is sorting it out, and you can probably wait a couple of days and see whether it sorts itself out, right? But if the opposite is happening, which means that you're having temperatures, you're giving appropriate amounts of the fever medication for the child's age and weight, which you need to speak to your doctor about. But either the temperature is not coming down to normal, or the temperature comes down, 2 hours later, it's back up. Then you have to give medication again. 2 or 3 hours later, it's back up. That's something that we definitely need to assess, because it's more likely that it might be something bacterial or there might be something else going on. So fever is it's a very common thing that parents will have to deal with, and it's something that you kind of need to understand the theory behind fevers, so we don't either freak out, or we don't over medicate, or we seek help when we need to seek help when your child has a fever.
So, dear listeners, please remember that you are not alone on this journey. Trust yourself, stay informed, and don't hesitate to reach out for help. Your child's health and development are a priority, but so is your well-being. Thank you for tuning in and listening to the Help We Need podcast. Stay tuned for more episodes on living your best lives. Until next time, stay empowered and remember to empower her.